Good morning, little nerds. It's Saturday morning. It means it is Pillow Talk Derm time. So get your pens and papers out, get your asses out of bed, and let's jump in. I am Dr. Shereene Idriss, a board certified dermatologist, and today we are going to tackle laser hair removal and how best you can help yourself when it comes to this topic. Because a few weeks ago, I posted a shorts video on laser hair fails, and the outrage in the comment section was insane, especially from you nerds who told me that you guys experienced the same thing in the video where your hair was not shaved and you developed burns and discoloration and hyperpigmentation. So I thought to myself, let's dive in, let's understand laser hair removal so that you can best help yourself so that you do not fall into that situation and you do not end up with burns on your face. So without further ado, laser hair removal. But small PSA from a dermatologist and a personal opinion. Any laser device, the outcome is only as good as the provider doing it, based on their knowledge, based on their education, based on their ethics. Laser hair removal specifically, because it is so widely popular, it is easy for the layperson, the consumer, to think, I don't need to spend a lot of money, I can get this down the road at a hair salon or at a nail salon. But the reality is, the number one reason when it comes to burns in patients from laser devices comes from laser hair removal, because it is so widely done without consideration taken into account that people are putting themselves under really intense devices and getting burnt in the process. So go to a reputable provider. That's my PSA. Understanding how a laser works is also very important for you to know why it matters for you. Knowing how a laser works is going to help determine which laser or which device you want to use. A laser is not a light. A light is many different wavelengths. Think of the rainbow. A laser is a specific wavelength of light. Laser hair removal works through a process known as selective, and that is a key word, photothermolysis, where that specific wavelength of light gets absorbed by pigment, in this case, the root of the hair, and converts that wavelength, that energy, into heat so that the root of the hair self-destructs. The word selective is key because you want the root of the hair to absorb the energy from the laser and not the surrounding tissue, because if the surrounding tissue absorbs it, what will you get? Discoloration, hyperpigmentation, and an unwanted burn. And that is why for years, the ideal candidate before we fine-tuned the technology was somebody who had dark hair with very light skin, because the laser would only target the dark hair without affecting the lighter skin. And that is why for so many years, people of darker skin tones felt like they couldn't get laser hair removal up until now. So what are the devices on the market that you need to look out for? The first one is a warning, and this is the one that you find everywhere because they're cheap. That's great, and that's also really bad. And they're often marketed as a laser, but they're not really lasers. They are known as IPLs, which stand for intense pulsed light. I just explained to you guys the difference between a light and a laser. An IPL is a light, it is not a laser. It emits light at various different wavelengths that the provider can cut off in order to target different skin tones and different issues. My biggest beef with IPL is that IPLs are not consistent. An IPL device varies from manufacturer to manufacturer in terms of the energy and the power that it gives off. It's not like a laser, which is calibrated to a specific wavelength of light. The energy and the power can kind of vary depending on the manufacturer. It's like saying, I'm gonna go buy fruit, but then you buy an apple. An apple is definitely not the same thing as a mango. Everyone knows a mango is like this and an apple is like that. And that's sort of what an IPL device is like. Depending on the manufacturer, it varies. So if you are gonna get an IPL treatment for laser hair removal, A, try to not be as melanated or tanned, because it's probably gonna not be the right choice for you, and if you wanna reduce your risk. And B, you wanna be damn sure that you're getting the Rolls Royce of IPL devices. So that's IPL. When you're talking about lasers on the market, there are several different types. The first one that came to market for laser hair removal was a ruby laser. We're not gonna waste our time talking about that. The other three that people often hear about are the diode laser, which is better if you are fair to medium skin tones. And the two most prominent ones are the Alex laser, which is a 755 nanometer, which can work really well from light to olive skin tones. It works very fast, but it is painful. And the Nd:YAG, which is a 1064 laser, which is great for darker skin tones because it bypasses the melanin in your skin when it targets the root of the hair. The issue with the Alex is that, with the Nd:YAG, is that it's not great for fine or very light hair. In my office, I have a device that combines two lasers in one, where you have an Alex and you have an Nd:YAG, so that you can blend the different wavelengths at the same time in order to target various hair types and skin tones at once. Because some people are darker here, lighter here, it just depends on the body part. That leads me to, why does that matter to you? Because now you have an understanding of what is better when it comes to laser hair removal and what you need to run away from or ask more questions about. We now understand that lasers can work on various skin tones, but what about hair colors? Because one of the biggest misconceptions around laser hair removal is redheads. Redheads do not respond as well to laser hair removal. It doesn't mean they don't respond at all. It just means they're going to need many more treatments. Why? Because the pigment in a redhead is very different than the person who has brown or black hair, and the laser is not geared towards targeting that sort of pigment. The best laser, if you are a redhead, is probably the Alex laser, but you're gonna need many more treatments. If you have white hair, laser hair removal is not for you. It will never work on somebody with white hair. You should instead opt for electrolysis. If you're a redhead or if you're a very, very blonde and you found that you cannot either afford the number of laser treatments that you need, or that you've tried it and it still hasn't worked for you, electrolysis is also an option for you. People with PCOS. PCOS is a condition in which you have a hormonal imbalance as a woman, and you tend to have more hair along the jawline, your neck, your chest, your belly button. Patients with PCOS come into my practice every single day, and I hear this every week: I am not a candidate for laser hair removal because of my PCOS. That is simply not true. The reality is, with PCOS, because you have that hormonal imbalance, you are going to ultimately need more treatments to get to the end result that you are looking for. It's not gonna happen as fast as in those who do not have a hormonal imbalance. So when it comes to PCOS, patience is the name of the game, and taking a longer term view on it, anywhere from 18 to 24 months, is probably what you're looking at to achieve your desired results. Do not feel sad by that timeline, because I'm gonna explain to you that timeline in a second. But PCOS patients remind me of patients of Mediterranean descent or Middle Eastern descent, in that there's a subset of patients who also develop something known as paradoxical hypertrichosis, where they get increased hair growth when undergoing laser hair removal. This tends to happen sometimes in the short run with patients with PCOS, as well as, like I just said, Middle Easterners or people of Mediterranean descent. And I have seen this in my practice as well. Like with PCOS, people with paradoxical hypertrichosis need more treatments over time. And they need to do them at a lesser intensity, with precautions like cooling and icing, in order to minimize any sort of heat damage that might trigger more hair. But it doesn't mean that that hair is going to stay there forever. It just means patience is the name of the game, and you now have an understanding of a risk that can come up. The risk, by the way, is anywhere from 0.5% up to 10%. And you know that if you're patient with more treatments over time, you will get to your end result of really not needing to wax or shave as much. So that is something I definitely wanted to hit on, because it is something you should go into with eyes wide open. Which leads me to, when do you see results? Most people will require anywhere from 6 to 10 treatments, spaced on average 6 weeks apart. So it will take anywhere from 12 to 18 months total in order to see results. It's not something that happens overnight, and it's something that happens progressively over time. First, you'll notice a decrease in density of hair, and then you'll also notice a decrease in the thickness of your hair, where it becomes thinner over time. This session is also very depending on the anatomical area, but again, patience, and it's not a key golden number that applies to everybody. How do you prepare for treatment? Let's go back to our laser hair video fail. You shave the area. You shave the area before coming in that day, because you do that out of consideration for your provider so there isn't hair all over the floor of your provider's office, but also in order to make sure that your skin is smooth and your skin barrier is not broken or inflamed by the time you get to your provider's office. You also shave between treatments, and you avoid waxing or tweezing, because when you are waxing or when you are tweezing, you are pulling the hair out of the root. And when you go in for your next treatment, it's not a guarantee that that hair is about to grow back. And the laser may not actively see the root and will not treat it as efficiently or effectively. And so you're ultimately wasting your dinero if you are shaving or waxing between treatments. Now, before you go in to your appointment, you want to also make sure that you avoid any sort of exfoliating acid or retinoid for 3 to 5 days before, so that your skin is not as sensitive and it is as less likely to burn in the process. You also want to make sure that you are not tanned, because being tanned will increase your risk of hyperpigmentation or discoloration. And ideally, you do not have any sort of self-tanner on your skin as well, so that the laser can truly function and truly separate any sort of color from your skin and the hair, and it can work to its best capacity. Use a clean razor, switch it out, use some shaving cream, and try not to stretch your skin while you're shaving, because when you stretch your skin, the hair can retract and go under the surface of the skin, and you can get ingrown hairs in that process. What about now aftercare? Avoid the sun. Don't go out into the sun because you're going to be a little bit more sensitive, and try not to exfoliate for a few days afterwards, again, because your skin will be a little bit raw. You do not want to irritate it in the process. And like I said, only shave, do not wax, do not tweeze. Now, what about laser home devices for laser hair removal? I am not a fan, because most of the time these are IPLs, and like I said, if an IPL at a provider's office can vary from manufacturer to manufacturer, imagine an IPL with an at-home device, which is not regulated at all, how that can vary from manufacturer to manufacturer. And if you are somebody who is even slightly melanated or who has a tan, you just increase your risk of a burn unnecessarily so. Plus, the energy and the power that that device is going to emit is going to require that you do hundreds of those treatments over time in order to get to an end result. So with that, I hope you guys enjoyed this video. Now you are better educated. Now you know to shave the area. I forgot to mention eye protection, but each laser comes with eye protective wear that you want to protect your eyes from the actual laser or light device. But now you know how not to get burnt, literally or figuratively, in the process. I'm Dr. Shereene Idriss. Have a beautiful Saturday, and I'll see you guys next week.